Surgery is a big deal for the body. Whether it's a planned procedure or an emergency operation, the experience can be overwhelming for patients and their families. The body undergoes significant stress during surgery, and the journey to full recovery doesn't end when the operation is over. In fact, the period immediately after surgery is often one of the most critical times for a patient's health and well-being. Even a small operation takes time to recover from. The effects of anesthesia, the body's response to surgical trauma, and the emotional impact of the experience all play a role in how quickly a patient can bounce back. Recovery is a process that requires careful attention and support. That's where the recovery room and you, the ODP, come in. As an operating department practitioner, you are the bridge between the operating theatre and the next stage of the patient's care. Your presence reassures patients and their loved ones that they are in safe hands as they begin to wake up from anesthesia. As an ODP, you're a vital part of the patient's journey back to health. You are there at a time when patients are often confused, disoriented, or in pain. Your calm, professional manner helps to ease their anxiety and provides comfort during a vulnerable moment. You provide expert care right after surgery. This means closely monitoring vital signs such as heart rate, blood pressure, and oxygen levels to ensure the patient is recovering as expected. You are trained to spot even the smallest changes that could indicate a problem. This time is crucial because patients are still feeling the effects of anesthesia and need close monitoring. They may be groggy, nauseous, or unable to communicate clearly. Your vigilance ensures that any complications, such as breathing difficulties or changes in consciousness, are caught early and managed quickly. Your role is to make sure the patient wakes up safely and comfortably. You help them orient to their surroundings, explain what's happening, and provide reassurance as they regain full awareness. Your support can make a world of difference in how a patient feels about their surgical experience. You'll watch for any problems and treat them quickly, whether it's managing a sudden drop in blood pressure, addressing breathing issues, or responding to pain or distress. Your quick thinking and expertise are essential to patient safety. You'll also help manage their pain, making sure they are as comfortable as possible. This might involve administering pain relief medication, adjusting their position, or simply offering a kind word and a listening ear. And before a patient leaves the recovery area, you make sure they are stable, checking that their vital signs are normal, their pain is under control, and they are ready to move to a ward or even go home. Your thoroughness ensures a smooth transition to the next stage of care. Being an ODP in recovery is a challenging but rewarding job. It requires a blend of technical skill, clinical knowledge, and genuine compassion. You work closely with surgeons, anaesthetists, and nurses, forming a vital part of the healthcare team. You make a real difference to patients at a vulnerable time. Your care, attention, and expertise help patients feel safe, supported, and on the path to recovery after surgery. The recovery room, also called the post-anesthesia care unit, is a specialized area. It's designed for close observation of patients just after surgery. Think of it as a bridge between the operating room and the ward or discharge lounge. Here, patients are closely monitored as they transition from the effects of anesthesia. The atmosphere is calm and controlled, with specialized equipment and trained staff ready for anything. You'll be checking vital signs, managing pain, and ensuring the patient wakes up safely and smoothly. One of the most critical things you'll do in recovery is manage the airway. Anesthesia can make the airway muscles relax, which can make breathing difficult. You need to be vigilant about keeping the airway clear. First, check if the patient is breathing easily. Look for the chest rising and falling. Listen for the sound of breath. You can feel for breath at the nose and mouth. If the patient is not breathing well, you may need to help them. This could be as simple as tilting their head back gently to open the airway. Or you might use special equipment to help them breathe, like an oxygen mask or airway support. Vital signs are like a window into how the patient is doing. They provide a real-time snapshot of the body's most important functions, allowing you to see how your patient is responding to surgery, medication, and the environment around them. By carefully observing these numbers, you can often spot subtle changes before a patient even feels unwell. In many ways, vital signs are the language the body uses to communicate with you, telling a story that goes beyond words. They tell you how the body is coping after surgery. For example, a stable heart rate and blood pressure can indicate that the patient is recovering well, while sudden changes might be the first sign of complications. Monitoring these signs closely is one of the most important responsibilities you have as a healthcare professional. The main vital signs you will monitor are heart rate, which is how fast the heart is beating, blood pressure, the pressure of blood against the artery walls, respiratory rate, meaning how many breaths the patient takes each minute, temperature, a measure of the body's internal temperature, and oxygen saturation, which is the amount of oxygen in the blood. Each of these numbers tells you something unique about how the patient's organs are functioning. For example, a low oxygen saturation might mean the lungs aren't working as well as they should, while a high temperature could be a sign of infection. Each vital sign gives you valuable information. When you look at them together, you get a much clearer picture of the patient's overall health. Trends over time are especially important. Sometimes a gradual change can be more significant than a single abnormal reading. You'll learn to recognize normal ranges for different patients. Remember, what's normal for one person might not be normal for another, especially in children, the elderly, or those with chronic conditions. That's why it's important to know your patient's baseline and watch for any changes. Any changes or trends outside of the expected range could signal a problem. For instance, a rising heart rate and falling blood pressure might suggest bleeding or shock, while a drop in oxygen saturation could mean the patient needs more support with their breathing. Early recognition and response can make a huge difference in patient outcomes. You'll need to document your findings carefully and alert the team if you notice anything concerning. Accurate and timely documentation ensures everyone involved in the patient's care is aware of any changes. By staying vigilant and proactive, you play a crucial role in keeping your patients safe and supporting their recovery every step of the way. Surgery and anesthesia can cause pain and nausea. It's important to manage these side effects so your patient can recover comfortably. There are different ways to control pain, including medications and non-drug methods. Medications like painkillers can be given through an IV line or as tablets. You'll need to know the different types of painkillers, their dosages, and potential side effects. Always double-check your calculations and be vigilant in monitoring the patient's response to medication. In addition to medication, you can use techniques like positioning the patient comfortably and providing a calm environment to help minimize pain and nausea. While most patients recover from surgery without incident, it's important to remember that complications can and do happen, sometimes even in the most routine cases. Being prepared to recognize and respond to these complications is a crucial part of patient care in the recovery room. Every member of the healthcare team plays a vital role in ensuring patient safety during this vulnerable period. Early recognition is key. By closely monitoring your patient's vital signs, appearance, and behavior, you can often spot subtle changes before they become serious. Acting swiftly and decisively can prevent minor issues from escalating into life-threatening emergencies. Some of the most common complications you may encounter include bleeding, watch for excessive blood loss from the surgical site, a sudden drop in blood pressure, or an increased heart rate. These can be signs of internal or external bleeding which may require immediate intervention. Always check dressings for fresh blood and monitor for signs of shock, such as pale or clammy skin. Infection. Be alert for fever, redness, swelling, or unusual discharge from the wound. Sometimes patients may also complain of increased pain or tenderness at the surgical site. Early signs of infection can be subtle, so it's important to trust your instincts and report any concerns promptly. Respiratory problems. Watch for difficulty breathing, changes in breathing rate, or low oxygen saturation. Listen for abnormal breath sounds and observe for signs of distress, such as restlessness or confusion. Promptly address any airway concerns, as respiratory compromise can develop quickly after surgery. Adverse reactions to anesthesia. Be aware of any known allergies and monitor for signs like nausea, vomiting, itching, or breathing difficulties. Some patients may experience confusion, shivering, or even more severe reactions such as anaphylaxis. Always be prepared to escalate care if you notice any concerning symptoms. Document any changes you observe and communicate them clearly to the rest of the team. Accurate and timely information sharing can help ensure the best possible outcome for your patient. If you suspect a complication, don't hesitate to call for help. It's always better to err on the side of caution and involve senior staff or emergency teams early, rather than waiting until the situation becomes critical. Your quick thinking and prompt actions can make a critical difference in the patient's outcome. Remember, time is often of the essence when dealing with post-operative complications. Above all, remember that you are not alone. You are part of a dedicated team. Supporting each other, sharing information, and working together ensures the safest possible care for every patient in your recovery room. Once a patient is stable and their vital signs are within a normal range, they can be discharged from recovery. This could mean going home or being transferred to a ward. Before discharge, make sure the patient meets all the criteria. They are awake and alert, their pain and nausea are controlled, they can breathe easily and their oxygen levels are good, their vital signs are stable and there are no signs of complications. You'll need to give a clear handover to the next team caring for the patient. This includes sharing vital sign trends, medications given, and any concerns. Clear communication ensures continuity of care. As an ODP in the recovery room, you play a critical role in the patient's surgical journey. You are their advocate and caregiver during a vulnerable time. Your expertise in airway management, vital sign monitoring, pain and nausea control, and early identification of complications ensures a safe and comfortable recovery. Remember to stay calm, be observant, and trust your instincts. Your dedication and compassion make a real difference in the lives of your patients.